Okay.
Good afternoon, and welcome to NOCC's Ask the Experts as we discuss heart health relating to ovarian cancer. We are delighted to be joined today by Dr. Tolu Agunbiade. Dr. Agunbiade is a cardiologist specializing in advanced heart failure and cardio-oncology at the MedStar Heart and Vascular Institute. She received her medical degree at Harvard Medical School and trained in internal medicine, cardiology, and advanced heart failure at Johns Hopkins. Dr. Agunbiade leads the cardio-oncology program at MedStar North, and as a cardio-oncologist specializes in the prevention and management of cardiovascular complications of chemotherapy and radiation. She is passionate about managing the cardiovascular health of women who are being treated for cancer, and she sees patients at MedStar Union Memorial Hospital and MedStar Good Samaritan. Welcome.
Thank you so much. And thank you so much for having me today.
We are so delighted to have you. To those who are watching right now, we will have time at the end for questions. So please feel free to use the chat box underneath to type your questions. I do ask, though, that you keep in mind we are only going to answer general questions. If you have very specific questions, you need to take those to your own care team. This is intended to give you the questions that you might want to ask your own physician. So now I say let's get to it. Our first question for you is: the long-term risk for cardiovascular disease is significantly greater for cancer survivors than for the average patient, and can be due to some of the long-term effects of the therapies and other reasons, which could be age. Can you talk to us a little bit about this?
Sure. So what you said is very true. We have data showing that cancer survivors are at increased risk of cardiovascular disease when compared to patients who have not had cancer. And this can be for many different reasons. In some cases, the therapies that are great for treating cancer can also affect the heart and the major blood vessels in the body in different ways. And this effect, we can sometimes see it right away. Sometimes it takes months or years, like 10 to 15 years later, for us to see the effects of the treatments that women or patients in general may have received years prior. One's risk of developing cardiovascular problems can also be affected by other factors like you mentioned, such as age or the presence of other known cardiovascular risk factors, such as high blood pressure, high cholesterol, diabetes, or by smoking, for example.
Okay. When would it be appropriate for a survivor to see a cardiologist, and when would it be necessary for someone to see a cardio-oncologist?
So that's a great question. So an ovarian cancer survivor could consider seeing a cardiologist if they develop any symptoms that they think could be related to a heart problem. Such symptoms include chest pain, and some women don't always have the typical chest pain. Some women just have chest pressure. As we all know, heart disease in women can present differently than it does in men. Additionally, other symptoms that should maybe make you think that something could be going on in the heart: if you start having shortness of breath, especially when you're moving around or exerting yourself and with your daily activities that's new for you. Some patients also can develop rhythm issues. So if you start having what we call palpitations, and some patients describe this as a fluttering in the heart that may come and go, or if you feel like your heart is suddenly skipping beats, for example, that could also indicate that something is going on with the rhythm in your heart. Another important symptom that I would mention is swelling in your legs. So if you start noticing that you're having new swelling, especially in both legs, you should certainly talk to your primary care physician about what could be causing that. And I would keep a heart problem potentially on the differential for that also. Essentially, I do recommend that if you develop any symptoms and you're wondering, could this be due to a heart problem? I would encourage you to talk to your primary care physician and say, should I see a cardiologist? So then what about a cardio-oncologist? So this is a new field. Cardio-oncologists, we basically focus on preventing and minimizing heart damage that's caused by either chemotherapy or radiation therapy. And there are all several different new drug classes that are coming out now that some may also have effects on the heart. We help to advise our colleagues about preventive strategies that can be employed to minimize a patient's risk of developing cardiac problems. We can help if cardiac complications develop while on treatment. We're also, we also help to manage, we help with monitoring. So for example, if someone is at increased risk of developing certain toxicities from the treatments they may be receiving, we can help to draft a plan for how often they should be monitored. And then even in the survivorship phase, if someone's at increased risk of developing complications multiple months or years in the future, like I previously mentioned, we can help with monitoring. So I think a cardio-oncologist, you can consider seeing one if you develop complications due to cancer treatment, if you develop complications that may affect your ability to continue receiving the intended treatment, or if problems develop in survivorship. And so if you just need specialized care in this area, that's when you could consider seeing a cardio-oncologist if there's one in your area.
So are there not normally cardio-oncologists at all hospitals? It's more of a, okay.
Yeah, so it's a new field and programs are increasing across the country, but I wouldn't say that they're as readily available as a general cardiologist may be, at least not yet.
Okay. You were talking a little bit more about what a cardio-oncologist does, and that is helping to minimize risk.
Mm-hmm.
Can you give us some ideas of what a survivor might be able to do in treatment or post-treatment to minimize or manage risk?
I think that's a very important question. So like I mentioned, there are several risk factors that are known to increase one's risk of developing heart disease. And this includes obesity, diabetes, hypertension, high cholesterol. If someone leads a very sedentary lifestyle, so minimal physical activity, and then a major one is also smoking. I tell my patients that it's always great to work with your primary care physician to help treat these modifiable risk factors that I just mentioned aggressively. So your primary care physician can help work with you to make sure that your blood pressure is at goal. They can help manage your your cholesterol numbers to make sure that your bad cholesterol levels are where they need to be. For those that are diabetics, they can help with tracking your blood glucoses and your A1C to ensure that your hemoglobin A1C, which is the number we track in patients that have diabetes, is under the number that it should be. Another major risk factor I would say for cardiovascular disease is smoking. And this is a big one. It's also one of the strongest, the most closely associated to shared risk. It's one of the strongest shared risk factors for both heart disease and cancer. And so as a cardiologist, I'm always talking to my patients about the importance of smoking cessation. So apart from those risk factors, I also think that to minimize your risk, exercise also plays a key role. Studies have shown that women, when they're being treated for cancer, they tend to exercise less, they tend to gain more weight, and they become less physically active in general. And it's because a lot is going on, which is understandable. But if the question that you're asking yourself is what can I do to help minimize my risk further, then I do think that trying to incorporate more physical activity into your day would be helpful. The American Heart Association, for example, they recommend that on average, we try to achieve 150 minutes per week of aerobic, of moderate intensity exercise, or 75 minutes of more vigorous activity. And those numbers may be daunting, right? And not everyone can achieve 150 minutes per week, but I always say start small and then just build up from there. But we do know that exercising has very well proven heart benefits in the long run.
And that's been a little bit hard during these last few months, being home with COVID and maybe not going to a gym and figuring out ways to get exercise when you're limited as to where you can go.
Agree.
So our okay, so let me see how to say this. Sorry. Because some cancer medications can raise heart disease risk, how important is it that a doctor monitors them for these side effects? And what would that look like?
So I think that's a great question. It's very important that if a patient will be receiving medications that can place them at increased risk of heart disease, that they be closely monitored for those toxicities. So for some treatments, for example, the FDA actually necessitates that you receive a baseline ultrasound of your heart to see what your heart function is like, even before you start on any treatment. There are some chemotherapy regimens that require monitoring more frequently than that. Some women need to get ultrasounds every 3 months, for example, while they're getting those treatments to make sure that they aren't developing any signs of toxicity. In the long term, monitoring can be different forms. So after someone has received chemotherapy that may be associated with different heart effects or toxicities in the future, we may say, okay, about a year after, you need to get this test done to look for any evidence of a problem. So I think that's how monitoring may look. And then for some patients, for example, and we'll talk a bit more about this later, monitoring for things like some medications can affect high blood pressure, right? Can affect your blood pressure. And so monitoring closely for that, and then just coming up with a plan with your oncologist for how often that may need to be done.
Most women with ovarian cancer are postmenopausal, and that might be because of age. It might be because menopause has been surgically induced as a result of treatment. But we know that menopause often results in weight gain, and that, as you said earlier, results can increase risk for heart problems. What strategies, if any, would you suggest for postmenopausal women?
Okay. I think that's a very important topic. And early menopause, as you point out, it comes with many challenges. And weight gain is one of the big ones. Two interventions that I think are I would highly recommend. So one of them is exercise, and then the other one is your diet. So there's a lot of science that has developed in the past couple of years supporting the role of exercise in cancer survivorship and heart health. And so nowadays, we know that cancer survivors, for example, can safely engage in enough exercise to improve physical fitness and restore physical functioning. We also have data showing us that exercise can improve quality of life and mitigate cancer-related fatigue in some situations. Along those lines, the American Cancer Society also, similarly to what the American Heart Association recommends, they also recommend 150 minutes per week of exercise for patients. And in addition, they actually recommend 1 to 2 days per week of strength training be incorporated into that. The tips I can offer as far as, because it's easy to say someone should exercise, right? But it's not always easy to implement. I think, as we all know. I usually tell my patients to set a low goal when you're starting. So maybe tell yourself, I'm going to do just 10 minutes per day for the first week. And then once you hit that low goal, it encourages you to want to do more. And then I would say, as you do more, you just keep increasing it from there until you hit the target that you set for yourself. Ideally 30 minutes, 4 to 5 times per week if possible. But again, different women have different limitations, and you do the most that you yourself can do based on where you are at that point in time. I think that exercise, as you're planning your exercise routine, I tell people, think about what you're most likely to do as far as exercise. So if you hate running, I guess saying that I'm going to start using a treadmill to run is not the best thing. So be honest with yourself and think, okay, what do I actually like to do and what will I actually do? And then pick your exercise modality. If you can't go to the gym, see what you can do within the home. And then after you've decided on what you want to do, it might be useful to then say, when am I most likely going to actually do this? Is it early in the morning before I start my day? Is it late at night after the kids are in bed and all my tasks are completed? Or in the times where people are working from home, can I do my exercise during my lunch break? And then once you've identified the type of exercise and the time of day you want to do it, try to minimize the barriers, any further barriers to getting you to accomplish that. So put your exercise equipment in a place that's easily accessible. So not in the corner of a basement, for example, where you're not likely to go. And then just decide to do it. And then as far as diet goes, I think there are many heart healthy diets that are recommended these days. And the basic principle is to maximize your fruits and vegetables and then to minimize carbs and high fat and cholesterol foods. And I think those are the big things I would advise the postmenopausal woman to help fight the weight gain that we often see.
Yes, yes. Moving a little bit more into ovarian cancer specifically, frontline treatment. for ovarian cancer is often Taxol and a platin drug like carbo or cisplatin. Do these drugs have any implications for long-term heart disease?
So thankfully, these medications have not been associated with significant cardiac toxicity in the short term or in the long term. In patients treated with these medications, I usually focus on other cardiac risk factors, as we've spoken about, and helping to optimize those to minimize the risk of cardiovascular disease in these women in the future.
Okay, well, that's reassuring.
Yeah.
Another common drug that many women who have ovarian cancer is a Parp inhibitor.
Mhm.
Do we know any link between that and any type of heart disease?
So it's interesting. These are relatively novel therapies, and so far, the reports do not indicate significant heart problems with this class of medications, which is great news
Yeah.
for you ladies. It can increase blood pressure and heart rate in some cases, and this will be monitored by the oncologist. But there are no significant toxic effects that we know of at this time.
Okay.
Interestingly, there's actually some data suggesting that it may be beneficial in animal models with heart failure, right? And so that's interesting. Yeah,
That's
and so that's
interesting.
yeah. And so that's one of the cool things about cardio-oncology, I would say, is that as new targeted therapies are used, sometimes we observe favorable effects on the heart and muscle that teach us about the heart and vessel biology.
Okay, we're going to talk about one more drug, which is Avastin, and that one we do know can elevate blood pressure.
Yes.
So, what kind of considerations should someone who is taking Avastin consider, or maybe some other drugs that are along these lines,
Mhm.
because of the effect of the elevated blood pressure?
So I think that the biggest thing is knowing that it can affect your blood pressure. And this is a conversation that your oncologist will probably have with you if you start on this medication. And so for those who already have a history of hypertension, it may mean that you need to more closely monitor your blood pressure, whether it be at your oncologist's office or with your primary care physician's office, or if you have a home monitor blood pressure machine, you may need to monitor that a bit more frequently, especially in the first few weeks when you started therapy, to then see what impact it's having on you. Even women who haven't had hypertension in the past can develop hypertension on these medications. So again, it's just checking the blood pressure whenever you go to the oncologist's office or your primary care doctor's office, or if you have access to a blood pressure machine, either someone you or someone in your home has it, especially when you're first starting, monitoring that so that if we see that your blood pressures are increasing, your primary care physician can work with you to help get that under control by starting appropriate medications.
We obviously cannot talk about heart health without addressing the topic of stress.
Mhm.
And we know that there's a lot of research out there, but stress certainly has an effect on things like high blood pressure, can lead to people wanting to smoke, can be inactivity. So I feel like we've covered this, but do you have suggestions to alleviate any kind of stress induced heart complications?
Yeah, I mean, so as I was thinking about the presentation, just thinking of the woman that we'll be viewing, it occurred to me again how many hats women wear, right? And we wear a lot of hats, whether it be that we're career women, we're wives, we're mothers, we're grandmothers taking care of grandkids, right? And in COVID times, we're doing so much more in the home with virtual learners. And sometimes it just seems like stress is inevitable. The strategies that I discuss with my patients when I'm counseling them, I tell them the first thing is to identify what is causing you to feel stressed. And then once you identify what's causing you to feel stressed, the question becomes, what are my coping mechanisms for that? Are they good coping mechanisms? Do I go and run a couple miles and say that's how I relieve stress? Or do I eat foods that may not be necessarily as healthy? Do I pick up a cigarette and smoke when I feel stressed? Some people drink alcohol to help alleviate stress. And sometimes the amounts can be more than it needs to be. And so I think just identifying what the coping mechanism is and whether it's a good coping mechanisms or something that may be maladaptive is the first step. And then once you identify that, decide on what other coping mechanisms you can adopt and what strategies, whether it be starting to exercise. Some women like yoga, some people journal, some people may need therapy to help them kind of work through things. And if that's what is needed, I think that's great. Um, But I think those are some of the strategies. And then I always think that an accountability partner is also helpful. So if you realize you're doing X when you shouldn't be, having someone that you can kind of check in with to as you work on those things would also sometimes is also helpful.
Those are great answers. I'd love to open it up now for some questions from our audience. So I'm just going to take a quick peek and see. Lots of people. Just a lot of people checking in. Not a lot of questions yet, but if there are questions out there, I encourage you to send them in. Nancy says, hello, in remission from stage 4, which spread. PJ says, thanks from a 35-year ovarian cancer survivor.
Congratulations.
Just trying to see. Tiffany says, hi from Texas. Liz has suggested the Body Project, which is a YouTube workout. So for those of you who are at home.
The home videos and the home, those are great because they're usually very short and you can just get it done quickly. And then you've gotten your exercise in for the day.
Tiffany said, having echocardiogram as I'm on Doxil. So I didn't mention Doxil, I said Taxol, and I don't know if there's differences in the terms of the heart implications. Maybe not.
So she's saying she got an echocardiogram done?
Yes, because she said because of the Doxil.
Yeah, and so the echocardiogram is basically an ultrasound of the heart that we use to kind of establish a baseline. So if there's a medication that could affect it, we do that at baseline to ensure that you don't already have evidence of a heart problem that may be further increased by the treatment that you are going to receive.
Nancy asked, does tamoxifen cause any damage if you take it long term?
So tamoxifen has not been associated with like toxicities such as heart failure and things like that. We do think of maybe venous, sometimes blood clots can be seen on that medication in the long run, but those are the big things. It's typically well tolerated from a cardiac perspective, a cardiovascular perspective.
Okay. Lots of people have checked in. This is great. Thank you all for watching. I hope you're finding this very interesting. We are putting, as I go through this, we are putting in the chat function a survey. So if you have a few extra minutes, if you don't mind just filling it out, letting us know your thoughts on this. Wow. A lot of people checked in. Okay, here's a question from Donna. Do hormone-based maintenance drugs cause heart troubles? And then they wrote letrozole, which, okay.
So hormone-based, so in the long run, there aren't a lot of cardiac toxicities that we see with them. Is a short answer for that. So in the long run, typically well tolerated.
Excellent. Somebody here asked, do you recommend a fitness tracker or Fitbit to keep on track?
So I think those are wonderful because it can prompt you when you're not hitting your goals, and it encourages you. And then if you set, I want to hit 10,000 steps, for example, you're going to try to hit those steps because you have something on your wrist every time you check the time that's telling you where you are. So I do think that if you can get one and you're someone that will actually use it the way it's intended, as in to motivate you to exercise, I think it's a wonderful tool to increase exercise.
Excellent. I think we have gone through all the questions. I'd love to just give everyone one more minute in case there are some last minute questions if we weren't able to address them. I really thank everybody who has participated. It looks like there is a lot of participation. So obviously an interest in heart health, which is fantastic. I'm not seeing anything else coming in, so I will wrap it up. Tammy just asked about Avastin's cardio side effects, but we've already addressed that, Tammy. So this video will be available to rewatch, and so if you would like to rewatch that, that would be great. Another question. A friend asked if radiation was used. Can that affect the heart?
So that's a great question, and it will depend on where the radiation was applied. So if the radiation is in the abdominal or pelvic region, then it's not going to cause any significant cardiac toxicity. It's more so when people have radiation therapy in the chest area, or to the like women who are getting treated for breast cancer or anything that's involving the chest area, especially if it's on the left side, then that's where we tend to see most of the toxicities associated with radiation therapy. Great question.
Okay. It looks like we have answered all the questions. I hope we have. And if anybody's out there and they have additional questions, please feel free to continue to type them. We will monitor them afterwards and we will reach back with questions for you. Thank you so much for taking the time and sharing your expertise with us. I think this was very insightful and very valuable. Again, as a reminder for those who are viewing, if you could just take a few minutes to complete the survey. Honestly, it will take about 2 or 3 minutes. All right, I'm sorry, I know I wrapped it up, but we have one more question, and that's about Gemzar. Any side effects from Gemzar?
No big side effects that we typically get.
Okay. So the good news is that most of the drugs that our ovarian cancer survivors have taken have less side effects than some others. So that's the good news if we're going to look at that.
Yeah.
Right. Okay. Well, thank you so much. I hope everyone learned something today, and I hope that we will see you next month for our next Facebook Live.
Thank you so much for having me.
Thank you.